Right. Hi, everyone. My name's Jason. I'm one of the coordinators for the Nepal trip for 2021, or Nepal team. I'm in my 5th year and I'm currently placed at the AL trip.
Hey everyone, my name's Harry and I'm also the other Nepal trip coordinator for TeamMED Nepal 2021. I'm also in my 5th year and I'm currently placed at Taragan at Latrobe Regional Hospital.
Right. So we've put together a bit of a presentation, which is an overview of our past trips and what our goals for 2021 are. So I'll just share screen. All right. So just to start off with a bit of info about Nepal. So, as I'm sure many of you know, a landlocked country between China and India in the Himalayan region of Asia, has a population of about 28 million, about 80% of which live rurally. So TeamMED's chosen to partner with Nepal, in particular because it's got a quite significantly under-resourced healthcare system. And its natural mountainous terrain makes it difficult for a lot of people, in particularly the rural areas, to access healthcare. So we've travelled there in the past to try support the local community to provide medical advice and care to those who would otherwise struggle to make the trip to Kathmandu. We've seen many patients in the past who've actually never seen a doctor or a dentist in their entire life. So to make the most valuable impact that we can in Nepal, we've partnered with an organisation called the Himalayan Gugai Organisation. They're a not-for-profit, non-government organisation whose primary goal is to promote health-related educational, cultural and community interventions in the Himalayan region of Nepal. So we rely on their knowledge to deliver an ethical and culturally sensitive impact in Nepal, and to identify villages with specific needs and to help us identify what those needs are. So we've made 8 previous trips to Nepal to 4 different Nepalese villages. In 2018, we managed to establish a permanent health post in the village of Bigu, which aligns with TeamMED's goals of establishing long-term valuable impacts. It's a great opportunity for med students to get involved in global health and to try really make a difference. Personal travel expenses are entirely self-funded by students, so all money that's fundraised goes directly to supporting the people in Nepal. So in 2021, we'll be providing support to the village of Bakanji. TeamMED last visited Bakanji in 2019, and that involved an 11-hour trip from Kathmandu to a nearby town by bus, followed by a 4-day hike into the village of Bakanji. This reached heights of up to 4,000 meters, so you're right there amongst the Himalayas. Here's Mount Everest for reference. So when the team was there, they ran a clinic which supported over 450 patients. The students hired a local Nepalese doctor who oversaw the running and were supported by volunteer nurses who were particularly valuable both for their nursing knowledge and to act as translators. So typically a 4th or a 5th year student would run consults with the support of a 2nd or 3rd year to help with things like examination and the histories. And then once a sort of diagnosis or a plan had been developed, this was run by the doctor, and medications and medical supplies were dispensed free of charge thanks to our donors. So we saw a huge variety of patients, everything from obstetric patients to pediatric patients, the very elderly, and then just even healthier individuals who just heard that there was a clinic running and came down to get a checkup. And then, as you can see, there were always long queues, and this was a great opportunity for some of the younger 1st and 2nd year students to run health promotion activities such as toothbrushing and dental hygiene. And these were designed together with the group earlier in the year. Now, unfortunately, a trip in 2021 is highly unlikely and we weren't able to go in 2020. But we feel that the need in Nepal is greater than ever. COVID's had a huge impact in Nepal. The pandemic's only deepened the needs of the population, with the number of cases over 275,000. A lockdown was initiated in March last year, but there was limited government support for the individuals affected by the lockdown, resulting in riots, and it was subsequently eased in about September. As we can see from the graph, that led to quite a significant uptick in cases, reaching a maximum of 5,700 cases in about mid-October. Fortunately, those cases have seemed to be consistently declining, but the ongoing unemployment, government debt, has meant that individuals have limited access to finances to support healthcare, and the government doesn't have the resources to help those individuals. Ongoing lack of tourism, which is a major source of income for Nepal, means that many have been left without an income. Those outside of Kathmandu are likely to be more affected, as the government generally, they've got limited support as it is from Kathmandu, but it's even less at the moment. So we feel it's therefore essential to make the biggest impact we can in 2021, even if we can't visit Nepal.
So our plan for 2021 is, I guess, a little bit dynamic, and it all depends on what's going on with the COVID situation this year. Obviously, 2020 was quite a difficult year to plan. I mean, we all started the year expecting to go to Nepal, and that didn't eventuate. But maybe at the end of this year that could happen. We won't really know for another few months. But so TeamMED often have a fundraising goal of about $12,000. I think that's what we sort of thought we could try for last year. And last year we ended up raising $6,000, which was just an amazing achievement. I think we both thought, after such a difficult year and with everything else that was going on, to still raise that amount of money was really quite amazing. And so we purchased some obstetric equipment and medications that got transported to Bakanji via jeeps, because obstetric equipment had been highlighted by the Tashi, who you guys will hear a bit about, as an area of need for Bakanji and their healthcare equipment that they really wanted. So I guess 2021 will again focus on fundraising and being able to purchase medical equipment and medications for Bakanji. Also, in previous years, there's been money put aside from all the money that got raised. So we would buy some medical equipment, and then with money that was left over from the pool that we got, that would get put towards ending up being able to hire a doctor that could actually go to Bakanji and start a health clinic and, you know, provide some ongoing healthcare to the villagers there and try and get a sustainable healthcare system going in Bakanji. So that's what any leftover money would be used for. So yeah, that would be our similar goals for 2021, with the potential for maybe going over, but obviously that's very hard to say at this point in time. So the fundraising basically involves donations from, you know, people like us, those interested in TeamMED, friends and family, you know, doing bake sales, sausage sizzles, trivia nights. Those kind of in-person fundraising drives weren't really available to us last year, I think, which made fundraising a lot more difficult because we weren't able to speak to people about what we were doing and be there face to face. So we're really hoping that this year we'll be able to get out there and, you know, talk to people in the community about what we're doing and raise some money that way. But we're really keen to hear from people who are interested about any other fundraising ideas that they might have. As well, Rotary and Lions clubs are really quite generous with their donations. So we have a few partnerships with some Rotary and Lions clubs that are ongoing. They give donations each year to help fund the trip and get the equipment over to Nepal. And also just with, you know, family and friends, we set up a Facebook page, and I think we'll try and do that again this year. So in 2020, basically, we spent $5,319 in medical supplies. So it was a lot of obstetric equipment and a lot of medicines as well, and then hired some Jeeps to get the equipment to Bakanji from Kathmandu. So applications start in April, and we're really keen to see who's interested in coming. And so, yeah, keep your eye on the TeamMED Facebook page. All year levels can come. Those are the costs of the trip if it goes ahead. But other than that, we'll be fundraising, putting all our efforts into trying to get as much money as possible to help out the people of Bakanji. And they're in a really tough spot right now with COVID and the way everything's going at the moment. So yeah, it's needed now more than ever.
Yeah, we're looking ahead to meeting you all and reading your applications and working hard towards doing the best we can in 2021, regardless of whether the trip goes ahead or not, although hopefully it does.
Thank you.
Thank you.